pretty easy, right? I just simply, you know, for instance, if it was skin to skin on a family member, I just simply blow, you know, tilt the head, blow, and it's, you know, a piece of cake. It's really not that easy. And you'll find this out again, as you have before, that it's not all that easy to do. Okay, so with the child starting at 1 year old on up, we need to squeeze the nose. How far back do we tilt the adult's head to open the airway? This is really important, because if you don't do this correctly, nothing else matters following this. So the head tilt is very aggressive on the adult, about 75% to the rear. Very aggressive head tilt to open the airway to the lungs. On the child, it's about halfway, about 50%. So remember those head tilts, 25 on the baby, 50 on the child, 75 on the adult, and you'll be pretty successful. Squeeze the nose, okay, that's head tilt, chin lift. 2 fingers here on the edge of the jaw, okay, in the bony part. Get that head back, and blow. Now, you want to be careful not to give too much air, because if we inflate the lungs too much, A, they don't need that much volume, and B, if they did get that much volume over several minutes before 911 resources showed up, what would happen to the patient? What are you doing that is detrimental?
Filling up their stomach with air.
Exactly. And depending on their stomach contents and how much air you've actually given them, then it can cause vomiting pretty easily. And then you're having to manage that and interrupt your CPR to do that, to manage that. Okay, now let's talk about the mask. So, the way that we like to seal the mask out in the field is more aggressively than the curriculum. The curriculum points out that if we can put one hand at the top half over the bridge of the nose and the thumb here, that gives us a little chin lift, and we blow, just like so. But if you have small hands as a rescuer, you have a large face and a beard, that will only complicate matters, those 3 things. So, to be really spot on, just about every time, okay, grab the mask more aggressively, seal it first, tilt the head second, and then blow. Okay? So be careful not to get in too much of a rush when you're coming, if you're doing this as a 1-person rescue, and you're coming off of compressions, 28, 29, 30. Be careful not to get in too much of a rush. Seal properly, head tilt, blow. So in real time, it looks like this, guys. 25, 26, 27, 28, 29, 30. Position the mask, seal, tilt, and blow. Okay, now, why do I not want to put the mask here or here? If it doesn't have the strap, I need to pull it off the face, but why would I not put it to the side?
Does it throw up?
Yeah, because if this patient does vomit, and I quickly get the patient to the side, which I should do before they aspirate into the lungs, and I sweep that out, what's the potential here?
You contaminate.
Did I contaminate my mask? I contaminate this here. And now I'm going to what? Compressions only CPR from this point, right? Okay, so that's a little bit on ventilations. We discussed the ventilations on the infants and then on the children and adults.